guys, it's about past 2 o'clock in the morning and I should really be asleep. I have an 8 o'clock appointment with employee health and I'll let you know why in a little bit. But I just wanted to say thank you so much for subscribing. I saw that I got a new subscriber. Wow. I didn't expect anybody to really subscribe to this or to even listen to me. And I haven't been getting messages before, but maybe YouTube changed some stuff. I don't know. And I wanted to say thank you to those of you who've left some comments. Like, I can't believe people are actually listening to me ramble. This is supposed to be just like a vlog. I normally journal write, but my hand's been really crappy and cramping and there's just too much information to process right now. I found it easier to just talk about it. Thanks for listening. And the really nice supportive comments, I really appreciate it. I was at work yesterday and just glancing at them and it made me so happy. It made me smile, so thank you. And I'm trying to leave even the meanest, crappiest comments on here. Unless it's really offensive, then I'll delete it. But I really like to hear from other people and encourage conversation. I love learning about people and their ideas and anything really. Okay, so this channel was not really meant for me to talk about this coronavirus, but I'm so passionate about it right now and I'm so obsessed with learning more about it and learning how to protect ourselves that I find that this is what I keep talking about. So that's what you will probably see a lot of on here until this whole thing dies down, and I hope it dies down soon. But I was actually telling my friend James, shout out to James, I'm trying to get him to open a YouTube channel because he is just this great source of information and knowledge about the virus, and he's the reason I know about this in the first place and have been taking it so seriously. I'm learning a lot from you and I really wish you share your knowledge with everybody else. Anyway, I spent a lot of time in the part 1 and part 2 videos about the virus just venting, and I was really holding back. There's so much more I want to say, and I'm torn because I'm also censoring myself. I don't want to get myself in trouble and I don't want to get a lot of people in trouble, but I feel like people should be more aware and informed, and I don't think the government is doing enough to get people to take this seriously. I am even so afraid to talk about this at work because even though I'm a nurse and I have firsthand experience and I take my issues up to management, I mean, it's like my views are totally opposite of the views of my hospital, my coworkers. Literally, out of, let's say, 84 people in my unit, literally only maybe 4 people are taking this seriously and watching the news and trying to protect themselves as much as they can. Actually, they're the ones who told me to take down my information from social media because I could get fired, because I've been talking about this so passionately and posting information about this and my views, and really I was passionate about hoping to get people to take this seriously and protect themselves and brainstorm ideas of how we could protect the community and the people around us and our families. And here's what's keeping me awake at night. This is why it's now almost 3 o'clock in the morning and I'm staying awake trying to figure this out. Maybe you guys have input for me. Here's this career that I've spent 12 years in and I'm so passionate about. Oh my God, by the way, you guys, I'm a crybaby. I get really passionate about things, and I'm also very I'm like an open book, so you will see me cry a lot. But wow, I never realized how passionate I really am about my career. And unfortunately, the healthcare business is just that. It's a business, at least in the United States, and I am so fucking frustrated seeing that they are putting money over people's lives. Okay, so here's my dilemma right now. I am trying to figure out if I should quit my job, which is not protecting me. It's going to be putting me at risk in case this outbreak really does happen, which they say it's going to happen by May, the hospitals will be inundated with people with the virus, and we have no way to protect ourselves. I totally forget how dangerous my job is until you're faced with something like this. And also the fact that I have to go to employee health in a few hours because I accidentally got blood in my mouth. I was very careful. I'm always very careful. I don't rush whenever I handle like bodily fluids, or try not to rush, even though we're really short staffed and we're running around like crazy. And this is without the outbreaks yet. Anyway, I was checking a patient's IV. I pulled out the blood into a syringe to check if it was in the vein. The syringe fell on the floor. Just my luck, it landed on the little plunger and squirted out the blood in the air. I'm like super congested because of allergies and whatever it is I have, and I'm a mouth breather, so guess what? It went in my mouth. Just like that. All this time I've been talking about being careful, washing my hands, I'm fighting to wear masks, which by the way, normally I had been wearing masks into my patients' rooms. And since we are short of masks, I didn't wear one. If I had one, it wouldn't have gone into my freaking mouth. And I wear glasses, so my eyes are always protected. Well, more for the most part. I mean, it could go in through the side, but basic protection that we don't have, and that was just a fluke. It was just like an accident. And so today they had to draw blood, and in a few hours I'm going to find out whether I have HIV, hepatitis B, hepatitis C, which I'm pretty confident that I don't, but you never know. They should test for the COVID-19 coronavirus while they're at it, but oops, we don't have tests. Okay, back to the coronavirus. My coworkers have told me that I needed to take off my stuff from social media because I have some supervisors and coworkers on my Facebook page, which, I was kind of hoping I'd wake somebody up because I have friends who have voices in the medical field. Unfortunately, they don't believe that this is real, and they believe that I am paranoid and am hyping this up. And I've had supervisors laugh in my face. And get this, one of the supervisors of a unit sent me on Facebook a little parody, because I like to sing. They sent me a little song about the virus. Like, I feel like it was mocking me because I called her out on this post by my hospital that said that we should just wash our hands, don't buy into this hype that the media is causing, and that the regular annual flu is a lot more dangerous than this. My hospital put out a video basically saying that, and I had like a whole paragraph replied to her. This is the reason you need to be concerned, blah, blah, blah. And then this is what I get in response. A little parody on the virus, a little song. Oh, and I haven't even shared this with you guys before, but my manager, when I went to talk to her a few days ago for half an hour about my concerns with this virus and staffing, and how we're already low staffed, and how I had a patient who I think might have had the virus but didn't get tested, and now he's discharged in the community, and how I probably should get tested too because I took care of him for 2 days. She goes, well, first of all, she said she didn't really know much about the virus and probably needs to look it up, and then said, are you one of those who started buying things, supplies, and panic buying basically? And I was like, oh yeah, I had all that stuff done in like February. And I just had a coworker who just came back from Korea on vacation, and she went to other places in Asia, and was kind of like bragging about how she didn't have to wear a mask in the airport and how they didn't test her. So I didn't have to wear a mask. And then she just came straight to work, because we don't require people to be quarantined after they come back from these countries. And so she had taken care of a patient with cancer who's on neutropenic precautions, meaning we should gown up and wear masks to protect the patient from germs because they have a very low immune system. But we don't have enough masks, so some people are not wearing them when they take care of this person, and she was one of them. Yes, I asked her to wear one, and yes, I'm bringing this up to people, infection control, tomorrow, but I'm just saying this thing is like out of control. Just FYI. But what do you guys think we should do? What should I do? If my hospital doesn't even think this is serious, and pretty soon we're going to start getting a lot of people with this virus, and I'm a high risk, I could barely breathe. I had to use my inhaler like 4 times today, and I'm not getting any sleep. I slept 1 hour in between 2 14-hour shifts. I picked up extra shifts because we're so short-staffed, so no, medical people are not sleeping, and we're not really taking care of ourselves. I'm trying to take vitamins, I'm trying to juice, I'm trying to build my immune system up, and then you've got all the stress at work, stress of people not listening to you. I got kicked out of the room because it's 3 o'clock in the morning and they want to sleep. How rude. Anyway, yeah, so I should probably get to sleep now. So no protection. We feel like we're going into this war. I'm trying to prepare myself, trying to prepare work and people around me, trying to gather up supplies and tell people that this thing is serious, and that I'm high risk, and we need an army of people to army, like medical staff, people ready to fight in the front lines. That's James' little analogy, soldiers, yes. Anyway, but it's true. It's coming. And people, my coworkers still want to go on vacation in Japan because they've already paid for it. I'm like, get a fucking refund. God. And I asked my nurse buddy the other day, I'm like, hey, so what do you think about this? And like how the hospital's preparing us and whatever. He was concerned about Coachella possibly getting canceled because he has tickets already, and he and his friends were trying to figure out, oh my god, what do I do if Coachella's canceled? I think our other option is just to go to Vegas. So like, I get it. We are not prepared for anything like this, but can we please come to terms with reality that this thing is actually out here and you can't control it? And people are talking about social distancing, that people around me and in the medical field, when we should be taking care of ourselves and educating ourselves about this, we're freaking going to Disney, like high touristy places, we're traveling still, and we're gonna bring this virus back, and we are taking care of like vulnerable population vulnerable populations. I just heard from a nurse friend who lives in Spain who just told me that the virus is exploding in her area, and in her county, or her city, they're the second most, they've got the second highest rate in her entire country of people confirmed with the virus. She said that she just got renewed training on how to wear the hazmat suit. She gets it twice a year. I've never worn it in my life. She works in pediatrics. But anyway, so they got trained for it. But she said when they have a confirmed patient that they're going to take care of, they're only wearing regular masks because they don't have enough to suit up with either. So you're getting trained, but then you don't have the equipment. Crap! I have to be up in 2 hours. Okay, I'm going to end this right now. I will try to ramble again tomorrow for anybody who wants to listen. Thank you so much if you got through all of this. Thank you for listening. If you have any feedback for me, please let me know. I am totally torn. I don't know what to do. I don't know who to talk to. I don't know how to get people to take this seriously. And I don't want to quit my job. I need health insurance, especially if most of the United States is going to end up having this virus anyway. And yet I want to just hide in my room. And I'm a big hugger, and I just want to hug people, and social distancing is very hard for me. So I don't like that this is happening at all, and I hope it all gets better. Like that, like magic, like what Trump said. It's just gonna all fade away and disappear, and we can all be happy again. Okay, take care. Thank you, bye.